Error. Electricity in line. Override accepted. Infusion initiated.
Welcome to the INS Infusion Room, the official podcast of the Infusion Nurses Society. In this podcast, we explore all things infusion therapy through a real-life conversation, covering the latest trends, new research, evolving standards, and key industry insights. Whether you're an experienced infusion nurse or new to the field, we aim to keep you informed and empowered with the knowledge to stay at the forefront of the profession. My name's Derek, and I'm your host. Let's dive in.
Hello and welcome to another episode from the INS Infusion. Today we have expert guest DJ Shannon joining the studio today. Welcome, DJ. How are you?
Hey there, I'm good. How are you doing?
I'm doing okay. So this particular episode is going to be one of three special podcasts to celebrate IV Nurses Day, our week-long celebration here at the Infusion Nurses Society to give back to the clinicians globally. This particular episode is sponsored by Solventum, and we have a special word from the sponsor.
3M Healthcare is now Solventum. You never stop solving for them. We never stop solving for you.
All right, DJ, do you mind to provide a little bit more about yourself?
Yeah, sure. It'd be really weird if I said no right now, though.
That would be
Just walk out of the room. Yeah, so I'm DJ Shannon. I'm an infection preventionist in Indiana. I have been working in infection prevention and infectious disease epidemiology for a little over 10 years at this point in my career. My background really started, my focus is antibiotic resistance, and in an effort to try to prevent antibiotic resistance infections. The main way that started to take shape for me professionally was through preventing device-associated infections. And so then through that lens, of course, I'm concerned about ventilators and Foley catheters, but then I really started honing in on our vascular access devices, especially, central lines is, our focus on CLABSIs, but then, there's a lot of conversation around our other vascular access devices like our midlines and our peripheral lines. And so then that really just continued my interest, and I wanted to really pursue that space. There aren't a lot of infection preventionists that are really focused in on that area. And so that was something that became of interest to me. And I had a wonderful mentor that kind of helped guide me along the way. And I'm sort of been along for the ride ever since. And so here we are.
Wonderful. So speaking of infection prevention, what do you think are the most persistent challenges clinicians face when preventing CABSI or CLABSIs in today's care environments?
Yeah, that is a huge question. I would say, in the general sense, I think I'll kind of be big and broad, and then I'll hone in on a more specific example. But I think a big challenge that I see with our caregivers today is actually the way that we in the quality or infection prevention or clinical nurse specialist kind of spaces, like how we approach the bedside caregivers. We tend to talk about things in specific buckets. Oh, there's CLABSI prevention. Oh, there's fall prevention. There's pressure injury prevention. But as a bedside nurse going in and providing care to a patient, you don't ever go in and say, okay, I'm only going to look at your central line and then I'm out. No, you go in and you address whatever needs are going on in the patient room and for that patient. And a lot of times, we might struggle to connect the dots when we approach the caregivers about these are all the things that we have to do to keep our patients safe. So really, really big answer, but I think we have this weird, disconnect with how we track and trend our outcomes, which then turns into education and practice change. And then that differs from how our caregivers are actually providing care. A really common practice that I see is specifically like with our central venous access devices is the insertion location. I'm sure we've all seen those fun vascular access devices come in high out of the neck, and then I have to have a dressing on a space that there's not a lot of skin, there's not a big landmark, there's a lot of bending, there's secretions, there's hair, you name it. It's really hard to keep those dressings intact. And, so then we just end up with this like lovely chandelier with a, or triple lumen hanging off the neck. And so I think, that's a really common challenge just based off of the device insertion location.
So beyond patient safety, what are some of the downstream effects when bloodstream infections occur?
So like anything that's not specifically the patient experiencing the harm?
So maybe cost or extended hospital stays, staff workload. Yeah, any of those examples that you see.
Yeah, of course, you just mentioned it. Of course, the patient is going to experience an increased length of stay, just one of their many things that they have in that process. But from the hospital side, not only does it impact the immediate dollars of the hospital in the sense that we aren't able to discharge that patient and then bring in a new patient. An unfortunate truth of it all is hospitals are also businesses and they have to have a way to make money. And so, length of stay really is a big impact and on the upfront, cost of doing business. But there's also this behind the scenes cost to it all as well, where something like a CLABSI or a CAUTI or what have you that's tracked and monitored federally, it comes with potential financial, it could be a reimbursement, it could be a good thing if you're doing a really good job, but it could also be a penalty if you are one of the lower performers. And so then, the hospitals actually have to pay money for their low performance on top of the added expenses that they already dealt with for taking care of that patient in the moment. And then there's also increased work time. So, that patient that now has an infection, we have probably additional labs that, caregivers are spending time drawing. Lab staff are working those labs up. Infection prevention is, spending time reviewing all of those labs and potential infections. Quality is trying to figure out process improvement for the hospital. There's just all these other things going on behind the scenes that really impacts workload as well when we have a lot of infections or negative patient outcomes occurring.
So moving into standards and or best practices, how have you seen these key areas evolve and strengthen recently within infection prevention strategies?
Yeah, so this to me is a really exciting space. So obviously, the INS standards, that's sort of the staple bread and butter. That standard has been pretty consistent for as long as I've known, saying take care of all of our vascular access devices.
Mm-hmm.
But when we look to guidelines or best practice documents or other resources, oftentimes they are completely focused in on our central lines because of federal tracking mandates, etc. The other vascular access devices, unfortunately, haven't received the love that our central lines have. But here in the last couple of years, we've started to see some additional resources or guidelines that are really starting to take shape and help navigate as we try to change the landscape of, from my perspective, preventing infections, but the quality of care of all vascular access devices. So we've got some friends like over at APIC, AVA, and the National Quality Forum. Just in the last, I think, 2 years, they've all put out resources that are focused on expanding our view of the vascular access device. So that's really, really exciting to see. We're starting to get some more resources available to help give some guidance on what to do. Because it's a really big mountain to climb when we start trying to look at improving care for all vascular access devices when so many of our patients have peripheral IVs. It's a big, big thing. So it's really nice to have some additional support.
So we often hear about concepts of bundled or layered protection. Can you talk about what that looks like in practice when aiming to prevent CABSIs or CLABSIs?
Yeah. So, bundle measures this sort of concept where we say, practice 1, 2, 3, and 4 are all proven things to help decrease an infection. And if you stick them all together, then those 4 things, that's a bundle. And so it's just a kind of cutesy term, but it's really, really taken hold and seems to be a pretty common vernacular these days. But we really see a lot more research and evidence and the guidelines, et cetera, focused in on those practices or those bundles around, again, like CLABSI. We don't have nearly as much evidence currently today to help give us the same kind of support when you're looking at care and maintenance for other vascular access devices. So, all things from insertion to maintenance to removal, there's elements of each of those buckets that are in a bundle, but largely they're focused in on our central lines. That's not to say that some facilities aren't really already focusing on other vascular access devices. And a lot of those documents that we just talked about, are kind of nodding to say, hey, maybe we need to be expanding that bundle to include, more or all vascular access devices.
And speaking of bundles, when you're including specific innovations, are there any recent innovations or product types that are helping expand protection?
Well, yes. There's all sorts of products, of course, that are coming out every day, but there's a couple that come to mind. I don't really know when they came out, but one, for example, is actually a device that can help. I'm not really sure the right words to use right here, but it can actually help with device like pulling on the catheter tubing, and it actually puts tension on that device rather than on the IV that is going into the patient. And so it can help reduce dislodgement. So that's good for many reasons. There's also, more recently, we've started to see dressings that we're already using for our central lines that have chlorhexidine. We're starting to see those dressings be made in sizes for our peripheral IVs as well. So, that's another, an advancement that's really cool.
And what are your viewpoints on securement systems, disinfecting caps, or other barrier technologies? Are they effective within the bundle?
Yeah, so I mean, depending on what specific element we're talking about, is going to be hit or miss with the specifics on the literature. But in the general sense, you're going to find things like that either in the guidelines or the standards that might say, like, yes, definitely do this, or consider doing these practices if you're still having issues, just depending on the data, right? But in the general sense, I think there's so many possible ways that care can go wrong inadvertently. So why not use additional technology to just try to help our caregivers keep our patients safe? As long as we're doing the right practices, then we can add some additional, tools in our belt.
Agreed. And with any innovation or advancement, there always comes an element of change. So this is my next question, and it's been a question I've asked, I believe, every expert on this season of the INS Infusion Room is talking about implementation. So what helps promote clinician confidence and adoption at the bedside whenever we're looking at implementing a new product?
Yeah, early and often communication. I can't tell you how many times, I've observed a change that's like, oh, hey guys, by the way, next week, this whole thing is going to be different. Let's back up, friends. As soon as we're starting to think about change, in my perspective, I want to go back to what's currently happening and why is it currently happening. And the only real way I can do that, quite frankly, I don't care about documentation. I want to go talk to my bedside staff. I want to understand exactly what's happening, what their knowledge, what their perception is, what their ideas are, try to really bring it back to them. And then make sure that we have the bedside caregivers involved in that conversation and in the evaluation when we are thinking about potential practice changes or product changes or whatever, whatever the situation is. It's just is going to either one, fail, or two, be way more difficult to implement if we don't have the bedside caregivers involved from the very, very beginning.
So can you share an example or scenario where implementing these types of protective solutions made a measurable difference in patient outcomes or workflow?
Yeah. So, like we mentioned earlier, some of the products that are available, this technology, the solutions, they may not have the same level of evidence, as what we're used to seeing for our central lines, for example. And so you might see that, for example, in the CABSI guide from APIC, that's, really focused on expanding the view of preventing bloodstream infections. It incorporates a section in the guide that actually talks about additional practices to consider. And in there, it's talking about how we might want to look at using dressings with chlorhexidine on additional vascular access devices beyond just central lines. It's in the additional section because, we don't have all the literature. But logically, if it works on central lines, it probably works on peripheral lines. My healthcare facility, we've actually looked at that and expanded the use of our CHD dressings to our PIVs. And so far, it's going well. And I think, we're taking the same measures to prevent bloodstream infections in our central lines as our peripherals. And to me, that's really important.
So as we continue to strive toward zero bloodstream infections, what do you see as the next frontier in CABSI and CLABSI prevention? It's a hard question. It is a hard question. A loaded question.
Yeah, very. I think what's really, I guess what I hope, let me say what I hope might happen. There's been a lot of recent collaboration between AVA and APIC and INS, and bringing those worlds together to say, hey, we are all taking care of these patients. We care about all of the negative outcomes for all vascular access devices. The patient only has one bloodstream. Let's just take care of the one bloodstream that the patient has. My hope and my gut says, this like new frontier, or however you ask the question, is going to be more and continued collaboration between our disciplines. The importance of our vascular access specialists, our infusion therapists, working with our infection preventionists to make sure we're all on the same page and doing whatever kind of work in tandem. I think that's really where we need to continue setting our sights. If, we're working in silos, we're going to be going left and you're going right, and we're not going to be making progress. And, as we're trying to expand what we're doing in terms of keeping our patients safe, I think we have to do that in collaboration.
I would agree. Collaboration is key. We are all working towards the same goal, and working together is going to get us closer to our goal quicker. So thank you for that message. And as we wrap up today's episode, what's one key message you'd like clinicians to walk away with from today's discussion?
The thing that I tend to keep top of my mind and that I share with my colleagues often is just a very short, simple, sweet, but all BSIs matter. And so, I think especially in a setting where we are very focused on CLABSI, we have to also take a step back and realize from the patient's perspective, they don't really care if their bloodstream infection came from a central line or a peripheral line. They're dealing with it regardless of the source, right? And so I think we need to have that same kind of mentality as we are taking care of our patients. So all BSIs matter.
Good key takeaway for sure. Thank you so much for joining us today in the studio, DJ. It's been a pleasure. And as always, I'm your host, Derek, and it's been a pleasure sharing this important discussion with you. Remember, knowledge empowers us to make informed decisions. Until next time, stay informed, stay curious, and keep gaining knowledge. Thank you for tuning in.
Infusion complete.